Comprehensive overview of shock. Shock is a critical, life-threatening syndrome where the circulatory system fails to provide adequate oxygen and nutrients to tissues, causing cellular hypoxia and metabolic failure. This condition progresses through stages, and it affects all organ systems, often with catastrophic consequences if not managed swiftly. Shock is complex, with several types and distinct physiological mechanisms, but understanding these allows for better recognition, intervention, and management. Understanding shock, definition, and mechanism. Shock occurs when the body's circulatory system cannot meet the tissue's oxygen demand. Under normal conditions, cells use aerobic metabolism, which relies on oxygen to produce ATP, adenosine triphosphate, the primary energy source for vital cellular functions. In shock, oxygen delivery is compromised, forcing cells into anaerobic metabolism. This metabolic shift is highly inefficient, producing only a fraction of the ATP produced in aerobic conditions, and results in the buildup of lactic acid, leading to metabolic acidosis. Metabolic acidosis disrupts cellular processes, and the body's response includes increasing heart rate and respiratory rate to try to compensate by circulating more oxygen and expelling carbon dioxide. However, as shock progresses, these compensatory mechanisms become overwhelmed, ultimately leading to organ dysfunction and failure. Classifications and types of shock. Shock can be categorized into 4 primary types, each with unique mechanisms and causes. 1. Distributive shock, characterized by severe vasodilation and reduced systemic vascular resistance, leading to insufficient blood return to the heart and, thus, inadequate perfusion. Septic shock, caused by overwhelming infection. Bacterial, viral, or fungal pathogens trigger an intense immune response, causing systemic vasodilation and increased capillary permeability. Anaphylactic shock, triggered by severe allergic reactions, usually to substances like food, medication, or insect venom. This type involves rapid vasodilation and fluid leakage from the blood vessels. Neurogenic shock, caused by trauma or damage to the autonomic nervous system, typically due to spinal cord or brain injury. Loss of sympathetic tone results in vasodilation, bradycardia, and low blood pressure. 2. Hypovolemic shock, occurs due to significant loss of blood or fluids, reducing blood volume. Hemorrhagic causes, trauma or internal bleeding. Non-hemorrhagic causes, severe dehydration from vomiting, diarrhea, burns, or other forms of fluid loss. 3. Cardiogenic shock, results from heart failure, which prevents the heart from pumping blood effectively. Causes include myocardial infarction, heart attack, heart failure, and arrhythmias. Despite an adequate blood volume, the compromised heart function reduces cardiac output and impairs tissue perfusion. 4. Obstructive shock, caused by a physical obstruction that prevents blood flow through the circulatory system. Cardiac tamponade, fluid accumulation around the heart compresses it, preventing effective pumping. Pulmonary embolism, a blood clot in the pulmonary arteries blocks blood flow to the lungs, impairing oxygenation. Tension pneumothorax, air trapped in the pleural space compresses the lungs and vessels, preventing blood from returning to the heart. Stages of shock. Shock progresses through specific stages, with symptoms becoming more severe and pronounced at each stage. 1. Initial stage. Cellular oxygen deficiency leads to a switch from aerobic to anaerobic metabolism, causing a buildup of lactic acid. Symptoms may be minimal or unnoticeable, though cellular dysfunction begins. 2. Compensatory stage. The body activates compensatory mechanisms. Heart rate and respiratory rate increase to maintain blood pressure and oxygenation. Peripheral vasoconstriction attempts to preserve blood flow to vital organs. Symptoms include mild hypotension, cool extremities, increased heart rate, and respiratory rate. In cases of sepsis, body temperature may also rise. 3. Progressive stage. Compensatory mechanisms fail, leading to tissue hypoxia and worsening metabolic acidosis. Blood pressure drops, mental status declines, urine output decreases, and lactic acidosis worsens. Symptoms intensify, and vital organs, particularly the brain, kidneys, and liver, suffer from reduced perfusion. 4. Refractory stage. Irreversible organ damage occurs, even with aggressive treatment. Severe hypotension, metabolic acidosis, and multi-organ failure lead to death as the body systems break down. Pathophysiology of shock. Shock involves numerous pathophysiological changes. Hypoxia. The lack of oxygen causes cells to switch to anaerobic metabolism, resulting in less ADP production and lactic acid accumulation. Lactic acidosis. Accumulated lactic acid reduces blood pH, impairing cellular enzymes and damaging tissues. Inflammatory response. Hypoxia triggers inflammation, which releases cytokines that worsen vasodilation, increase capillary permeability, and exacerbate fluid loss. Vascular changes. Vasodilation decreases systemic vascular resistance, making it harder for the heart to maintain blood pressure, particularly in distributive shock types. Capillary leak. Increased permeability allows plasma to leak into interstitial spaces, further reducing blood volume and worsening hypotension. Fluid compartments and fluid shifts in shock. Body fluids are distributed across several compartments, and these can be disrupted in shock. Intracellular fluid. The fluid within cells, accounting for around 60% of total body fluid. Extracellular fluid, divided into intravascular fluid, within blood vessels, and interstitial fluid, surrounding cells. Shock can disrupt this balance. Intravascular fluid loss. Blood or plasma loss reduces circulating volume, leading to hypotension. Interstitial fluid accumulation. Fluid can accumulate excessively in tissues, causing edema. Third spacing. Fluid accumulates in spaces where it does not contribute to circulation, such as the abdominal or pleural cavities, which further impairs perfusion. Compensatory mechanisms in shock. The body attempts to maintain circulation through several mechanisms. Cardiac output, CO determined by heart rate and stroke volume. It increases through higher heart rate and contractility. Systemic vascular resistance, SVR. The body modulates SVR to maintain blood pressure, with vasoconstriction compensating in hypovolemic and cardiogenic shock. Neurohormonal response. Hormones like adrenaline and noradrenaline are released, constricting blood vessels and retaining fluid to sustain blood pressure. Signs and symptoms across different types of shock. Certain signs and symptoms are common across shock types, although specific manifestations vary. Key features include increased heart rate, a common response to maintain cardiac output. Low blood pressure, a hallmark of shock as circulatory collapse worsens. Mental status changes. Patients may become anxious, confused, or lethargic due to cerebral hypoxia. Skin changes. Skin may be cool and clammy in hypovolemic and cardiogenic shock, but warm and flushed in distributive shock due to vasodilation. Respiratory distress. Acidosis stimulates increased respiratory rate to expel carbon dioxide. Oliguria. Reduced urine output as the kidneys conserve fluid. Management of shock. The management of shock focuses on restoring perfusion and oxygenation, with specific interventions tailored to the type of shock. 1. Fluid resuscitation in hypovolemic and septic shock. Intravenous fluids, crystalloids, or blood products help restore circulating volume. Types of fluids, such as isotonic or hypertonic solutions, vary by patient condition, with ongoing debates about the best choice. 2. Vasoactive medications. Vasopressors. Drugs like norepinephrine constrict blood vessels and increase blood pressure, particularly useful in distributive shock. Inotropes. Drugs like dobutamine increase cardiac contractility, aiding cardiogenic shock. 3. Oxygen therapy. Supplemental oxygen supports tissue oxygenation and assists in managing respiratory distress. 4. Addressing underlying causes. Treating the root cause of shock is essential. Septic shock requires early antibiotic administration and infection source control. Anaphylactic shock, managed with epinephrine to counteract severe allergic responses. Cardiogenic shock may require interventions like arrhythmia correction, thrombolysis for clots, or surgery for structural issues. The role of monitoring and early detection. Early detection and monitoring are crucial in managing shock. Recognizing trends in heart rate, blood pressure, respiratory rate, and lactate levels can indicate the onset or progression of shock, even if initial compensatory mechanisms mask symptoms. Special attention should be paid to high-risk groups like the elderly, immunocompromised patients, or those with comorbidities who may deteriorate rapidly or show atypical symptoms, such as normothermic sepsis. Conclusion: shock is a complex, multifaceted condition involving circulatory failure, cellular hypoxia, metabolic acidosis, and potential multi-organ failure. Early recognition and understanding of the underlying mechanisms, types, and physiological responses to shock allow healthcare providers to implement life-saving interventions and improve patient outcomes. Through a combination of fluid resuscitation, vasoactive medications, oxygen therapy, and targeted treatment of underlying causes, it is possible to stabilize patients and interrupt the destructive cycle of shock.